Very interesting details are coming from India. An Indian doctor, Dr. Sister Forms, a cardiologist who attended to Raila Odinga when he collapsed, has spoken. I want us to listen to the doctor, for she's revealing some very interesting information worth sharing out here. In this forum, we don't propagate falsehoods. We don't do speculations. We only talk of things that have been confirmed and proved. Kenyans are saying all sorts of things around Raila Odinga's death. All sorts of things. But in this forum, we only do verified information and confirmed facts. Listen to this doctor before we continue.
Mr. Raila Amlo, 80 years old, former Kenyan Prime Minister, was brought to our emergency medicine today morning at 8:20 a.m. with a history of sudden collapse during his morning walk at Sritariyam, which is an Ayurvedic hospital close to our place. Then itself, they had started CPR, that is cardiorespiratory resuscitation, and he was brought with a CPR, active CPR. His doctor and security were with him, and we continued CPR and did emergency intubation, that is putting a tube in the respiratory system, trachea, and continued CPR along with other resuscitative measures. Initially, there was no pulse or BP recordable, even palpation-wise. So after doing intubation with continued CPR, we shifted the patient to our ICU with all the staff and the facilities. In ICU, after some time, we could get some rhythm. On the monitor, it showed ST elevation in the ECG leads, in the anterior leads, plus we could see regional wall motion abnormalities, that is reduced movement of one artery territory, that is LAD territory. There was hypokinesia. This means there is less movement in that area. So after stabilizing him with some IV fluid and all, we just give him an injection, that is injection reticulase, for dissolving the clot if it is there in the coronary arteries. And we could see him with a significant edema of the right lower limb, right leg. When whatever information we got from the doctor was he was a diabetic, hypertensive, chronic kidney disease patient. He had right lower limb DVT, for which he was put on IVC filter. And recently he had a thin subdural hematoma. Last Saturday when it was done, that was almost very thin. And the neurosurgeon was the doctor who was with us in the ICU and who followed the patient from, accompanied the patient from Sritariyam. So after discussing with him, we went ahead with the thrombolysis with the injection reticulase. Even we continued CPR, that is from 8 o'clock in Sritariyam till 9:52 in our ICU. With all other ACLS criteria, we continued CPR. In spite of our very sincere, very continued CPR and other measures, we couldn't make him survive. So we are very sorry to inform that he is no more with us, and our very sincere condolence and prayers for his family and for the Kenyan people. That's what happened.
Thus, the cardiologist who attended to Raila Odinga, and she's making it very clear that Raila Odinga was brought to their casualty emergency medicine at 8:20 a.m. That was yesterday. And that happened after Raila Odinga collapsed during his morning walk. So Raila was on a morning walk when he collapsed. Upon Raila Odinga collapsing, he was taken to this hospital. I want Kenyans to understand one thing there. He collapsed and then he was taken there. He was taken there because he collapsed. So many questions can be asked, but one thing coming out very clearly, Raila collapsed and then was rushed to that hospital. That's what this doctor is just confirming. And the doctor also says that Raila Odinga had some medical conditions that they were trying to solve. First of all, she says Raila had diabetes. Second, Raila had hypertension. Third, Raila Odinga had chronic kidney disease. Fourth, Raila had right lower limb DVT, deep vein thrombosis. And then fifth, Raila Odinga had subdural hematoma. Let's understand what these diseases are. What is diabetes? Diabetes is a condition that happens when your blood sugar glucose is too high. It develops when your pancreas doesn't make enough insulin or any at all, or when your body isn't responding to the effects of insulin properly. Diabetes affects people of all ages. Most forms of diabetes are chronic, lifelong, and all forms are manageable with medications and or lifestyle changes. So diabetes is basically a lifestyle disease. Dr. Sister Fons is just confirming that Raila Odinga had diabetes, and then she also confirms that Raila Odinga had hypertension. What is hypertension? Hypertension or high blood pressure is a condition where the force of blood against artery walls is persistently increasing the risk of serious problems like stroke and heart attack. It is often asymptomatic, which is why it's called the silent killer, but can be diagnosed with a blood pressure reading. Treatment includes lifestyle changes like a healthy diet, exercise, and weight management, along with medications if necessary. Sometimes you can have high blood pressure without even knowing. What's chronic kidney disease? CKD is a progressive condition characterized by the kidney's inability to filter waste and excess water from the blood for at least 3 months, often leading to a buildup of toxins and fluid in the body. Common symptoms which develop as the disease progresses include fatigue, swelling, nausea, and changes in urination. While there is no cure, treatments focus on controlling blood pressure and blood sugar, managing symptoms with medication, adopting a healthy lifestyle, and in severe cases, dialysis or a kidney transplant. That's what a chronic kidney disease is. What's a right lower limb DVT or deep vein thrombosis? A right lower limb DVT, in other words, deep vein thrombosis, is a blood clot in a deep vein of the right leg, which can cause swelling, pain, and redness or discoloration of the skin. Symptoms often include leg pain, tenderness, and warmth, and it's important to seek medical attention immediately if these symptoms are present, as DVT can lead to a pulmonary embolism (PE). Treatments typically involve blood thinners, compression, stockings, and potentially invasive procedures for extensive clots. So Raila Odinga had that right lower limb DVT. And upon Raila leaving Kenya for India, we all knew he had a leg problem. And the doctor is just confirming that. I've stated that here we don't do propaganda. We don't peddle lies and falsehoods. We only say what has been confirmed, the actual information as it is. The doctor is also saying Raila Odinga had subdural hematoma. What is a subdural hematoma? A subdural hematoma is a collection of blood that forms between the dura mater and the brain, often caused by a traumatic head injury like a fall or car accident. Symptoms can include headache, confusion, drowsiness, and weakness, and treatment depends on the severity but may involve emergency surgery to drain the blood. So Raila Odinga had those 5 chronic conditions. And when I say that, I'm not ruling out anything. Anything can happen. We've even seen in some cases where a doctor can be bribed. So Kenyans should not misunderstand or misquote me. I'm not ruling out anything here. But what I'm saying, we don't report falsehoods. We only report factual information and what has been confirmed. Kenyans should also know that Raila Odinga was in India, and by his side was his daughter Winnie and sister Ruth Odinga. These 2 individuals were by Raila Odinga's side when he was in India. And nothing can happen under this sun that cannot be revealed. If at all there was a false play, if somebody caused Raila Odinga's death, I'm pretty sure it's just a matter of time. The truth will come out. But as of now, what has been confirmed and proved is that Raila Odinga had these 5 chronic conditions. Yes, that's what has been proved. And we also know only God gives and only God takes. A person's life is sacrosanct, sacred. Only God gives and only God takes. Let's meet in our next update. Thank you. God bless you. God bless Kenya.